Straw Hut Media.
I tell you, they can even get a dentist. Sometimes, I'm just, what I am verbalizing are stories that my patients have told me. They called, they made the appointment. Once they get to the door, they said, oh, sorry, we can't take care of you.
Is healthcare a right or a privilege? Amid a national debate, one group finds itself in the crosshairs, the transgender community. Today, we're diving headfirst into a hot-button issue that's making waves in news and politics, the critical role of mental health support in gender-affirming care. Amidst a wave of legislation across the U.S. that seeks to restrict access to gender-affirming care, the need for comprehensive mental health support within the LGBTQIA+ community has never been more urgent. This issue, often overlooked, is now a controversial topic, making headlines and stirring conversations nationwide. Our guest today is Dr. Angela Rodriguez, a renowned plastic surgeon and the founder of Art Surgical in San Francisco. Dr. Rodriguez is a trailblazer, providing comprehensive, gender-affirming care beyond medical interventions. She believes in holistic well-being and ensures her patients receive top-tier care, including mental health support, social services, and advocacy. Dr. Rodriguez reveals why she decided to specialize in gender-affirming surgery and holistic care for the trans community. We'll talk about how she approaches comprehensive care for trans patients beyond surgical interventions and the importance of mental health support in gender-affirming medical practices. We'll also discuss the challenges trans individuals often face in accessing quality healthcare, and how Dr. Rodriguez's practice addresses these challenges. From affordability to advocacy, we'll uncover how we can all contribute to advocating for the rights and needs of the trans community within the medical field and beyond. Dr. Rodriguez also shares a memorable story from her practice that highlights the impact of holistic care on a patient's journey. She then discusses what healthcare providers can do to create more inclusive and affirming environments for trans patients, and how we can all stay informed about the latest developments and best practices in gender-affirming care. So get ready as we dive into this critical conversation, shedding light on the intersection of mental health and gender-affirming care, and how we can all play a part in supporting the trans community.
I am Dr. Angela Rodriguez, and this is Pride.
Tell me a little bit about you before we jump in to talking about gender identity and affirming care. Tell me how you got started.
Thank you, Liva. Thank you so much for having me here. Well, as you can notice from the accent, I'm from Colombian origin, and I've been in the States for many, many years. I came to do research, and then, I got into the medical field, and you get into a little tunnel where time escapes. Really, you lose like decades at times trying to train and trying to become a good doctor. And I trained in Massachusetts, and I came to Stanford and did extra training in craniofacial surgery. And I practiced for like half of my career, taking care of kids with birth defects, cleft, craniofacial, complex cases for many, many years. And when I saw what was going on in gender-affirming care, I'm like, I got to do that the second half of my career. There is no way as a craniofacial surgeon that I'm not going to be doing facial feminization. So that's what got me into gender-affirming care.
What inspired you to specifically specialize in gender-affirming care? Was it just the realization that your skills could be applied to that? Or was there something else about the trans community that really drew you to it?
Well, a number of things. It's never one thing. Number one, I'm a member myself of the LGBTQI community. I am married to a wonderful woman from Madrid. And I sort of was a late coming out. As a Latin American, 99% of people are Catholic. There is a lot of it's basically not the United States. I love the United States because it allows that diversity and things happen here first socially. But my career has always been aligned with a deep sense of serving, basically, and serving communities that are alienated a little bit. So I took care of a poor population in California, Central Valley, kids with birth defects for many, many years as a craniofacial surgeon. And I think, I've never been the typical, I think, your career sort of finds, and in my mind, it's very important to be in coordination with who I am and how I can be of service. And at the same time, I think this is the great civil rights issues of our time. So if I had an opportunity to jump in there and do it, I was going to be there.
How do you approach comprehensive care when it comes to trans patients beyond just surgical interventions? Because I think a lot of people, specifically beyond the LGBTQ plus community, straight people, they perceive it as something that's very quick and you just decide to go in and have surgeries to confirm your gender identity. But how does it actually start when you're approaching a case with a patient? What does it really start with?
It has to be comprehensive approach. First of all, the patient goes to a number of specialists before getting surgery. Number one, not everybody needs surgery. I don't want people out there to think that because they are transgender, male, woman, non-binary, that they necessarily have to have surgery. I can be transgender, but I can feel comfortable with a body that has lived for 30, 40 years, and I don't want to have a surgical intervention. So the idea is to allow the patient to be who they are. I mean, I truly believe that the easiest way to put it is they were born on the body that was not for them. And they know this from very, very early. I like to talk to patients a lot and ask them, when did you know? That doesn't mean that, society is ready or that the patient needs to have treatment right then, but they know very, very early. So a lot of the patients get to a therapist, they explore these issues, or they already know. But in order to, for example, have surgery, in order to get into the health system, get hormones, they need to have an evaluation by either a primary care physician, an internist, an endocrinologist, a mental health therapist, and see if, for example, hormones therapy are going to take care of their gender dysphoria, which is a profound sense of, your body is something different than what you were meant to be in. And once that happens, if the person continues to have dysphoria, if they have a deep desire to, for example, they are extremely dysphoria about certain part of their body, then they pursue surgery, but not everybody pursues surgery. So this is not something that you can go to a plastic surgeon and have a ticket and have a date for surgery because one morning you decided something. This is something that takes a long process. And a lot of our patients have an issue with that. They call it gatekeeping, and we can talk about that later.
I think that there's a lot of people in the media that talk about the transitioning process as if it is really just a surgical thing, and mental health and mental health support are not really part of gender-affirming care. I think of people like J.K. Rowling, that talks about people just having surgery super quickly on Twitter, right, is what she used as her platform. But could you elaborate a little bit more on the importance of mental health support and how it plays into gender-affirming medical practices before any sort of surgical intervention, I think is what you said?
Yeah, so I believe that, before I go into the importance of mental health care, which is important, by the way, not only for gender-affirming patients, but, we live in a turmoil and it's important for all of us. And there's going to be a day where meditation is going to be probably a class in elementary school. We all need to be there. But I just say for people like J.K. Rowling said, other people that take these things so lightly, that is what is so important, that you are giving us this platform to be able to educate people. Other than helping my patients, I have no specific interest in, people being transgender or not being transgender. I think it's very important to educate, and I'll say exposure, exposure, and exposure. Once you've known people, once you have somebody close to you, a friend, many patients, like in my case, then you'll understand the importance. But yeah, mental health, we all benefit from mental health care. Why is it important that our patients in gender affirming care have a pathway? Number one, because they need to explore this. Number two, other people may be extremely sure of who they are, but they still because have comorbidities, stress, lack of social support, rejection, transphobia. It's all out there, correct? So we need to make sure that they are going to be able to cope with the stress of surgery, because surgery is extremely stressful for anybody. And we want all the comorbidities taken care of. Also, if you think about that, Levi, when you have a hernia, right? I can diagnose a hernia and I said, oh, you need a herniorrhaphy. When I diagnose somebody with gender dysphoria, I am a plastic surgeon. I cannot make that diagnosis. That's a mental health diagnosis, correct? So I need to be able to have a competent partner in healthcare that is going to make this diagnosis before the patient comes to my office.
So that seems like a really critical step, even in your practice in plastic surgery specifically. Mental health is like that's like the front lines.
It's at the front lines. If I get a letter or a report from a mental health provider that says, well, this patient yes, they need a gender affirming surgery, but they may not be ready. They need to have a little bit more therapy, up their medications, have better support. We treat this, it's very comprehensive. Just like I did with cleft craniofacial kids, right? It's a multidisciplinary group.
For someone who is experiencing gender dysphoria, how hard is it for them? Obviously, it depends on the state you're in. There's a lot of laws going on in the United States. There's a lot of things being rolled back, or even new laws that are in place to really constrict gender-affirming care, especially for minors. So how challenging is it for someone, if they're experiencing gender dysphoria, even to get started with mental health care, to get towards transitioning? How hard is that process?
It's difficult. I mean, think about it. We, up until a few years ago, we didn't have doctors specifically trained. We didn't have groups, universities. I saw one transgender patient in my career as a resident in plastic surgery. So out of the blue, we have in 2016, I think 1.4 million people that are transgender. And we have to take care of them. And these are people from different stages. Some are living at home still 18, 19, 20 years of age. Some people are people that are 60 and 70. So they have to, the medical association is the WPATH, the World Professional Association for Transgender Healthcare. And they suggest what the guidelines are. They are not requisites. They are guidelines that they give to us. And the first thing is, yes, you need to access through your primary care physician. That is easy in San Francisco. Imagine somebody in Alabama. My patients can even get a primary care physician in Alabama.
So they can't even get started with that.
I'll tell you, they can even get a dentist. Sometimes, I mean, I'm just, what I am verbalizing are stories that my patients have told me. They called, they made the appointment. Once they get to the door, they said, oh, sorry, we can't take care of you.
So that really begs the question, is healthcare a privilege or a right?
Exactly. It should be And I can tell you, I can tell you the world, according to Angela Rodriguez, that it should be a right. But it's a difficult and very vulnerable situation to be in.
What challenges do trans individuals face in accessing not just gender-affirming healthcare, but healthcare in general? How does your practice address these challenges, and why do they exist?
Yeah, I think it's just a matter of education and exposure. And obviously, we live in a moment that is extremely polarized. And I believe if we can just go back to the basics and recover humanity and see us as individuals, will do a better job. But yes, unfortunately, even trying to get a primary care physician or any other type of physician is difficult.
Your practice, your website, pretty much everything around kind of your digital brand, it really advocates for the rights to healthcare for trans men, trans women, non-binary individuals. How do you feel like as a healthcare professional, but also as a practice, that you are advocating for healthcare for trans and non-binary people, the transgender community, within the medical field, and even just beyond? Like you said, that we're all humans, we all have rights. How can we all advocate for trans people?
Getting involved, I think it is important. We're involved with different groups in the community, and the community is very diverse. Also, you think there is a number of patients and large part of the community, for example, here in San Francisco, in California, that are Spanish speaking, and we have talked about, for many, many years, about how to deliver healthcare with people with another languages. And finally, hospitals have translators and all these things. So you put another layer when the patient speaks a different language, doesn't understand the system. When we live in places like San Francisco, we do try to make things easier for the patients. I think is definitely a model that should be taken to the national level. But we pride ourselves of being a small practice, almost giving, it's a boutique practice, but giving service to the levels of concierge practice. I see all my patients. I have a physician assistant. I am not in the business of doing assembly line surgery. My patients need me better. I rather do a few patients, but extreme quality. And I think that patients understand that. And with the challenges with mental health, the apprehension, the being so anxious, I think this works very well for the trans community.
Could you share any memorable success stories from your practice that really highlight the impact and the importance of holistic care in a patient's journey? And I know you can't share names for, confidentiality reasons, but have there been any patients that you've worked with that really stuck with you?
Liva, you probably are not going to believe me, but there is no day. I have office hours. So I work, sometime in my office, I have to see patients before the operation and after the operation that come for, checkups. And the rest of the week I operate. But there is almost no day of my Mondays that there is not a tear of happiness in my practice. When you take the bandages off, when you take the dressings, and finally they see themselves how, they should have been. And my patients are extremely appreciative. I do remember the case of a Spanish-speaking patient, very, very nice lady who grabbed my hand right before going into the operating room. And she said, in Spanish, "Dr. Rodriguez, I need you to promise something for me." And, very dramatic. I'm like, of course. What do you need? She said, "Well, promise me that if I die in surgery," I'm like, "You're not going to die. This is an elective surgery. Many things can happen, but it's less than 1% chance of dying." She said, "Promise that you are going to put up until the last stitch, even if I die, because I want to go to my next life how I was meant to be." it's, it is really profound and moving. And I have nothing but respect. For me, it's truly an honor to be working on this field.
I mean, you've really created a very inclusive space within healthcare and providing healthcare. What are some steps that other healthcare providers can take to create more inclusive and affirming environments specifically for non-binary and trans people?
I have a great model. There are great practices here in San Francisco. I think any practice needs to concentrate on not only, putting it in paper and saying how diverse are, but not only talk the talk, but walk the walk. We have, in my practice, 80% of us are part of the LGBTQI community. 80% of us are bilingual with Spanish as a first or second language, in my case, first language. But so you have to, apply what you do on a day-to-day basis on, what is it that my patients would benefit from, and, put it to their service and figure it out a way to do it.
And if there was something, a wish or something that you wish that other healthcare providers knew when it comes to providing comprehensive care to trans people, what would that be?
I think it's not even to trans people only. I think having a life experience, Levi, helps. I think we really, and we say this over and over, we have to listen to our patients, and we have to listen. But I think in general, we don't listen to each other anymore. But in the case of a patient, the patient is most of the times right. If they are telling you they are unhappy or that they want something done, there is a reason for that. And for the patients know their body better. We definitely need to listen a little bit more to our patients.
Staying informed all the time with the latest developments and best practices in gender-affirming care, because it's so new. How do you do that? How can other healthcare providers do that? How can they stay up to date?
These days, there are multiple resources, webinars. I go to 3-4 national and international conferences a year. You write papers, you present on those topics that you like. You need to get involved, or if you don't want to do that, you can just attend the conferences. We have groups in San Francisco, multiple groups that we get together and talk about common problems that we have, how to facilitate access to care to patients. So these days is really I think it's a lot easier than in the past. After the pandemic, I think the web definitely opened this huge window for us.
And for anyone listening that is considering pursuing gender-affirming care or believes they may have gender dysphoria, if they're outside of California, could they still come to your practice and receive care?
They can come to California. I think, definitely in San Francisco, we have many, many practices, and many people come from different states. They, like anything else, they have to call, figure it out if the insurance they have is going to work. Sometimes insurances from other states won't work. So they have to think about funding the surgery themselves. And not only that, Liva, but they have to stay, because I can't operate on a patient and send them home, correct? I need to do at least 1 or 2 checkups in person while the patient is here. So all of those things add up. Also, the social support. A lot of our patients are ostracized from their families. They have, very few people in their lives, and they need somebody to be with them after surgery. It is been proven over and over that if you have emotional support, you're going to heal faster, you're going to feel better, and your whole experience is going to be much better quality.
And for listeners that are experiencing gender dysphoria, if you had one thing to tell them or that they could take with them from this episode about that journey they may begin to embark on, what would that be?
I would say breathe. It is a journey. It's definitely not a definitive destination. We're getting better and better. We are working with the health system in order to provide and quickly training and having, great skills to help. But you need to breathe and go through the pathway. We are there to help. And as far as insurance, that is a difficult problem to tackle. I mean, we haven't been able to fix it in a long time. I think that's a much more of a global problem than only for gender-affirming patients. But I don't have good answers for that one. I believe in paying it forward. There is even a group of transgender people that help the next person. Somebody helps them with the surgery, stays with them, and then they help the next person. I think it has to come from the community, because if we sit down and wait for governments that are not have the best of our interests in mind, it's just going to take many, many years. But I think, we would have to organize. And I understand, politically it can be better in some places, but I think, we can organize, and we have ways here. They have been, we've come with a lot of generosity from groups, from churches that allow housing for short periods of time at a sliding scale level, to help people that have to come and stay for 2 to 3 weeks. Actually, we just lost one of those houses, but all we can do is keep trying. But I believe that effort has to come from the community.
Pride is a production of Straw Hut Media. If you like the show, please leave us a rating and a review on Apple Podcasts, Spotify, or wherever you listen to podcasts. Then, follow us on TikTok, Instagram, Facebook, the app formerly known as Twitter, and Snapchat @Pride, and tune in weekly for more episodes. Be sure to share this episode with your friends and subscribe for more stories from amazing queer people. If you'd like to connect with me, you can follow me everywhere @Levi Chambers. Pride is produced by me, Levi Chambers, Maggie Bowles, Ryan Tillotson, and Brandon Marlowe, and edited by Daniel Ferreira.